As someone who had cancer at the age of 13, as someone who has worked at the U.S. Department of Health and Human Services, actually running the Obamacare Marketplace, as someone who's currently program director at the National Kidney Foundation, a healthcare nonprofit, and as someone who was then Vice President Biden's Director of Outreach for a healthcare program called the Cancer Moonshot, healthcare is obviously very personal. That's why we were the first in this entire race back in October to also release a healthcare agenda. That is a comprehensive approach that talks about everything from enshrining abortion care and gender-affirming therapy at the federal level, making sure we have comprehensive sex ed in all of our public schools, which teach about everything from abstinence to contraceptives to gender identity to consent, making sure we have free menstrual products in every public restroom, because if toilet paper can be free, social menstrual products. Talk about living donor protections, making sure we reform our nurse-to-patient ratio so that they actually have the support that they need to provide that type of care, making sure that we also lift the earnings cap to expand and extend the solvency of Social Security, which is obviously a really big problem and does tie into healthcare, and also making sure, as is noted in my card, we have Medicare for All, which will not only eliminate premiums, deductibles, and copays for all of us, but it will also save the U.S. economy more than $600 billion a year. So there's an economic component to also making sure that more people have access to health care.